It is the intratemporal part of the facial nerve that is the most important. So let's go into its details. Okay, we know that the intratemporal part of facial nerve consists of the labyrinthine segment followed by the first of all we have the meatal segment, and from there it goes into the labyrinthine segment, and then you have the tympanic and the mastoid segment, and this tympanic and mastoid segment has got an intricate relationship with the mid-layer, and that is what we have to know the most, because this is the area where as ENT surgeons we are dealing with, right? So we will be learning in detail that area now. We have already learned a little bit about this area, right, when we learned about the anatomy of mid-layer. So this is the medial wall of mid-layer, and here we have the posterior wall. Now this is the labyrinthine segment. It forms a bend like this, and that is what is called as the genu, and then it forms a second bend and then forms the mastoid segment, and this mastoid segment then comes out through a foramen, that is what is called as the stylomastoid foramen, and then it divides into 2, which further divides into 5. Okay, so how is this happening? This is the labyrinthine segment, and here we have the genu, right, and this genu has got some landmarks which we have already learned, but let me revise it for you. What are they? Here you have the processus cochleariformis, and then from above you have one thing which is known as the cog, right? So this is the cog, this is the processus cochleariformis, right? So these both form the landmark for facial nerve. Okay, landmark for the geniculate ganglion part of the facial nerve, and here you have the labyrinthine segment. This is the tympanic part. Okay, now this part, how do we know? This part has got certain areas related which forms the landmarks. Okay, this is the lateral semicircular canal. Okay, here you have the lateral semicircular canal, and below you have the oval window. Here you have the oval window. Okay, now then it goes into the posterior wall of the mid-layer after bending again, that is the second genu, and here it forms the mastoid segment. Okay, here you have the mastoid segment, and yes, there is another landmark over here which is the short process of ingress. It is being lodged in the fossa incudis, right? Here you have the fossa incudis, and this is how the intratemporal part of the facial nerve is seen. Okay, so here you have the facial nerve coming from the interlocutory meatus. Okay, so this is the meatal segment, right, and then it goes into the labyrinthine segment. This picture, this is only for you to understand. Okay, here if you look at this picture, you might think that the labyrinthine segment is longer than the meatal segment, but it is not like that. The meatal segment is about 1 centimeter in length, 8 to 10 millimeter in length, whereas the labyrinthine segment is only 4 millimeter in length. Okay, so that's about the facial nerve and its landmarks. Okay, so this picture also we are very much familiar with, right? Now, how are we going to learn its various branches? Okay, what are the various branches of facial nerve? First of all, we have the branch arising from the genu, and what is that known as? It is called the greater petrosal nerve. Okay, now this greater petrosal nerve is the one which supplies the secretomotor fibers to the lacrimal gland. Okay, so it is responsible for lacrimation. So that is the first branch of the facial nerve, and in the tympanic segment there are no branches for facial nerve. Then from the mastoid segment you have got one branch. What is that? That is the nerve to stapedius. Now where is the stapedius muscle? It is seen arising from the pyramid. Okay, pyramid. So here you have the pyramid, and from that arises the stapedius muscle, and it goes on to insert into the neck of the stapes. Okay, stapes. And so this pyramid also forms a landmark. Okay, pyramid is a landmark for the mastoid segment. So what are the landmarks for the mastoid segment? One is the pyramid, and the second is the short process of Ingus. Okay, short process of Ingus. Okay, now what are the other branches? Here you have the nervus stapedius, and then just before the facial nerve exits through the stylomastoid foramen arises another branch, which is called the chorda tympani. Okay, this chorda tympani goes on like this and comes out through the posterior canaliculus, which is seen just medial to the lateral wall of the middle ear. Okay, here it arises, and what happens to it? It then goes in between the middle fibrous layer and inner mucosal layer of the pars flaccida of the tympanic membrane, and it also goes between the malleus and the Ingus, and finally comes out to the anterior canaliculus and goes on to supply the anterior two-third of the tongue. Okay, so this is the chorda tympani you have here, chorda tympani. Okay, now just after it comes out, it gives a branch which is the posterior communicating branch. This posterior communicating branch is the one which supplies the area of posterior superior part of the external aortic canal. Okay, it is having a communication with the vagus nerve to supply the area of the external aortic canal, conga, retroauricular groove. Okay, that area. Okay, that is by the posterior communicating branch, and also there are certain branches such as nerve to the stylohyoid muscle and the nerve to the posterior part of the digastric. The posterior belly of digastric is being supplied by the facial nerve, right? And only after that it is dividing into the 5 branches. Okay, so this is in brief about the facial nerve. Now, okay, this picture also you are very much familiar with, right? Now, what are the things that you see here? This is the lateral semicircular canal. It forms a landmark, right? What else are the things you can see here? Oval window you can see. That is also a landmark for the tympanic segment. Okay, here you have the chorda tympani. This is the chorda tympani that you see here. It arises just before the facial nerve exits through the stylomastoid foramen. You have the tympanic plexus here. This is the tympanic plexus. Okay, and here you have the pyramid as well as the stapedius tendon. This is the stapedius tendon, and this pyramid forms a landmark for the vertical part of facial nerve, right? So here you can see how the chorda tympani goes through the middle ear cavity. It enters through the posterior canaliculus, then goes through the middle ear cavity between the handle of malleus and the Ingus, and then goes between the middle fibrous layer and inner mucosal layer of the pars flaccida, comes out through the anterior canaliculus or the canal of Hugger, which is a part of the pituitary fissure or Glaserian fissure. Okay, so here you have the anterior canaliculus. This is also known as Hugger's canal. Now, what are the other things seen within the Hugger's canal? You have the anterior malleolar ligament, right? Yes, then the anterior tympanic branch. Okay, all these things are going through the canal of Hugger, right? Now, this facial nerve, as you can see here, it has got a motor root as a sensory root, and this sensory root is what is called the nervus intermedius. It joins with the motor root before it goes on to become the various parts, the intracranial part, the labyrinthine part, all those things are happening only after this nervous intermediate goes and joins with the motor root. Okay, so that is happening in the intracranial part itself, and now we can see how the facial nerve is going like this. Okay, here this is the posterior part, this is the anterior part. Okay, and earlier you have the carotid artery. That is why the anterior wall of the middle is known as the carotid wall. Okay, and from the carotid artery surrounding it, it has got caroticotympanic nerves. Okay, caroticotympanic nerves. All these things we have already dealt with while covering the anatomy of middle ear, right? Okay, this is the quadrata tympani branch. Now, why did I keep this picture here? Because you can see how it is related with the lingual nerve, auriculotemporal nerve, right? Lingual nerve, auriculotemporal nerve are all branches of the mandibular nerve, but it is through the lingual nerve, the quadrata tympani nerve goes on to supplies the anterior two-third of the tongue. Okay, and so this is the Vedian nerve that you see here in the infralateral part of the sphenoid sinus. Okay, and this Vedian nerve is the one which is responsible for the final secretomotor pathway of the lacrimation. Okay, so from the facial nerve you have the nervous intermediate part of the facial nerve which is associated with lacrimation, and from the facial nerve arises the greater petrosal nerve. You can see the greater petrosal nerve going like this. Okay, it joins with the deep petrosal nerve here. Deep petrosal nerve arises from the sympathetic plexus around the internal carotid artery, so it is a sympathetic branch, right? So the sympathetic part is the deep petrosal nerve, greater petrosal nerve is the parasympathetic part, and they join together to form the nerve of pterygoid canal or the Vedian nerve. Okay, so this Vedian nerve then goes on to the infralateral part of the sphenoid sinus. Okay, and this Vedian nerve can be excised in case of increased lacrimation, as in crocodile tears, or in case of the rhinitis, vasomotor rhinitis. You might need to go for an excision of the Vedian nerve when it is recalcitrant. Okay. Now, what happens to the facial nerve after that? After that, it goes into the parotid gland. After exiting the stylomastoid foramen, it goes into the parotid gland. Okay, after it supplies the nerve posterior belly of digastric as well as the stylohyoid muscle through its branch, it goes into the parotid gland. You can see another branch here. What is that? The posterior auricular branch. Okay, this is the branch which is supplying the auricular muscles. Okay, now this is the branch which is going into the posterior belly of digastric as well as the styloid muscle, and within the parotid gland it divides into two, and here this is forming a plane within the parotid gland. That is what is called the facial-venous plane of Patty, and this facial nerve divides into two, that is the temporofacial and the cervicofacial part. That is further divided as the temporal branch, zygomatic branch, buccal branch, marginal branch, and the cervical branch. And as you can see here, this resembles the, yes, what does it resemble? It resembles the feet of goose, right? It resembles the feet of goose. That is why it gets its name, pes anserinus. Okay, just like this you have the branches of facial nerve, so it gets the name pes anserinus. Okay, so this is how the facial nerve branching occurs. Okay, now there are some anomalies of facial nerve that you have to know about, which are seen congenitally. What are they? One thing, the facial canal can be dehiscent. That is the most common congenital anomaly. And what else can be seen? You can see the prolapse of facial nerve. Okay, here you have the prolapse of facial nerve. This is the facial canal dehiscence that you see here. You can see the prolapse of facial nerve, the facial nerve can bifurcate, okay, or else it can bifurcate and rejoin like this around the oval window, or it can pass between the oval window and the round window, or it can trifurcate, as you can see here. Okay, these are the various anomalies seen, but when you are asked what is the most common congenital anomaly of facial nerve, it is the facial canal dehiscence or the dehiscence of the fallopian canal. That is the most common congenital anomaly. Okay,